WDSU News Channel 6, on your side.
There are some new weight gain guidelines for pregnant women, and tonight we want to make sure you know what's too much and what's not enough. We're on call with a physician from Touro Hospital. WDSU News Channel 6 anchor Randy Russo has more on the guidelines.
Well, for women who are pregnant, weight gain is a key factor for a baby's growth and development. Here to give us the skinny on what's too much or not enough weight gain during pregnancy is Touro OB/GYN Dr. Rebecca Perret. Dr. Perret, thanks for joining us on call. I'd like to first off by asking, what are the new weight gain guidelines for pregnant women?
The weight gain guidelines have been out, the latest was out in 2005, but they sort of reflect the newer trend for recognition that obesity and just overweight women in the United States is higher than what was recognized in the 1980s and 1990s. Over 50% of women are now considered overweight or obese, and these new guidelines reflect that recognition.
Now, why is that so important when it comes to a baby's health? And I can understand the risk of obesity, but how does that go directly to a child?
Well, women who are overweight or obese have a much higher risk during pregnancy. Some of those risks include diabetes, development of diabetes, or pre-existing diabetes. Those women are at higher risk for a cesarean section. They're also at higher risk for developing high blood pressure, which is also known as preeclampsia. That can be potentially life-threatening for the mother and for the child, or pre-existing high blood pressure, which can also cause growth restriction for a baby.
Now, Dr. Perret, are these restrictions or these new guidelines, are they just for people in the U.S. or are other countries going to adopt these guidelines as well?
I think that this is recognized worldwide.
Well, mothers who don't gain enough weight can also put their children at risk.